I'm here with Dr. Robin Van Zellen, right? Did I pronounce it right?
Yeah.
Okay, good. So I've been coming for 4 or 5 years to get my thermography done with her because I'm 42 and I've chosen to do this instead of doing typical or say traditional mammographies, because I personally am afraid of the radiation. I just don't want to put radiation in my body, so I looked for an alternative. And the first time I did it, I had a full body scan just to make sure that there wasn't anything irregular. And then every year I just get a breast scan, and that way that gives me my peace of mind that I'm healthy. And we were just discussing actually that compared to my first visit, as I'm aging, I just keep getting healthier. So this is just really exciting. And so we have some images that we can show you, and then also Dr. Robin will explain what thermography is.
So basically what thermography is, it's a screening process for early detection of any pain, pathology, injury, particularly appropriate for breast screening because again it is completely non-invasive. So there's no radiation, no compression. It's basically the camera is taking an image of your body, and what it's doing, it's picking up any of the heat being emitted from your body, and then those images are portrayed up on my computer screen. And at that point, we submit those images to a group of medical doctors who have taken 2 extra years training at Duke University to be certified thermologists. They do the interpretation, and then that information comes back to me, and then I give the report to the patient. And again, so with thermography, it is a test of function or physiology. So any of changes that are going on in our breast tissue, we can pick those up. So for example, if there's estrogen dominance, lymphatic congestion, fibrocystic activity, and even early neovascularity. So if we note any of those changes, we try to refer our patients a more holistic or natural approach to preventing it so it doesn't turn into a breast disease in the future. So the biggest difference with mammography, again, that is a test of structure. So for a mammogram to note abnormality, there has to be a mass there. And on average, by the time a mass is formed, it's been there for 5 to 10 years. So with thermography, we pick up that activity, your breast tissue changing to start to develop and actually, feed the nutrients, the tumor to make it grow.
And we were just discussing, so I was actually asking her a lot of questions while I was in here, because a lot of my clients are starting to ask me questions about like breast augmentation and just autoimmune issues. And so Dr. Robin was explaining to me that they can actually see autoimmune like heat pattern when someone is starting to develop autoimmune issues or just irregularities in the tissue. And then one woman in particular, she, once she gets that information, then she decided to go and handle things all naturally. So that's where, like, what I do for a living has actually shown in these scans. Well, I don't know if they've shown in the scans really, but I know personally that I just keep getting healthier and my breast tissue keeps getting healthier. And it's all natural, like it's completely due to my lifestyle and my diet and lymph massage and connective tissue or fascia massage. So that's how these modalities can blend so well, because I send all of my clients to get thermography done so that they can avoid radiation, but then if something shows up, then we can address it by anti-inflammatory foods, anti-inflammatory supplements, different lifestyle changes. So it's really a great way to become healthier overall, avoid the radiation, but you still get checked every year. So you're not ignoring it and then all of a sudden you have a lump. It's actually, you're going to see it, you're going to detect it
these
years
changes. Right, exactly, because our breast physiology really should be stable, and as soon as there is change going on, like I mentioned previously, we have to figure out what change is going on and why is it going on, and then we have to address it so we can reverse it.
Exactly, and it is possible to grow younger and to be healthier as you age, and if you do have health issues, it is totally possible to help yourself.
Definitely.
Yeah, which is key. The body is designed to heal.
Yep, that's right.
We forget that.
Yeah.
The body is a self-healing mechanism.
Exactly, yep.
Yeah. Okay, thank you.
Yeah, you're very welcome. Thank you.